So thank you so much for inviting me. This has been an amazing conference, and it's great to get to connect with people around Sacramento. So just as a little background about me, I've been in emergency medicine just about forever, since the dark ages. I started in college as a clerk in the emergency department, then I became a technician in the emergency department. I was a nurse for 6 years, and then I ended up going back to medical school. So I'm an emergency physician. And then I ended up getting my MBA with a focus on performance improvement, and actually did a lot of work on improving hospitals across the country. So I worked for Kaiser Permanente for about 20 years. I led our 21 emergency departments in Northern California until I retired, and then I worked for TeamHealth, helping them improve their ERs across the country. And now they pulled me out of retirement to be the director down at Lodi Memorial Hospital right at the beginning of the pandemic, so kind of a little of a disaster. And I have 3 kids. All of them are in college, one in Boulder, one in Santa Barbara, and the one blessing of COVID is I get to have my freshman at UCLA daughter here at home with me for this last year. So could you go ahead and advance for me, please? I'm going to talk a little bit today about managing workplace stress and anxiety in a pandemic. It's not a small problem at all, and I'm going to reiterate a lot about what the panel said and just kind of show you from our view from the front line as well. So next slide, please. So this is definitely the crisis of all of our lifetime. It's become a little bit routine that we just think it's here, but when you really realize how huge it is, over 44 million confirmed infections as of this week, and over 1.1 million people have died. And for us in the United States, over 9 million confirmed cases and 233,000 people have died. So nothing we've ever seen in my lifetime, and I'm fairly old. So next slide, please. And I think what makes this pandemic particularly difficult is that there's no end in sight. So I was around for H1N1, and we dealt with it. It was a couple months, over, done, we're finished. The same thing with Ebola. It was very, very scary, but it came and went in a very short time. But now there's really no end in sight. And how do you keep people motivated? How do you keep people working? How do you keep people doing what they have to do when you don't have a finite end for what's going to happen? Next slide, please. And this was our place down at Lodi. And what's really rough about this for us in healthcare is that, for one thing, we have to completely change our operations to deal with COVID because we want to keep our patients safe, right? So we had to completely redesign everything and do that. But on the other side, patients just stopped coming. So we were seeing patients who waited 12 days with a stroke at home, or we would see a lot of heart attacks that died at home because people became afraid to come to the hospital. So we were really caught between a rock and a hard place. We had to make all these COVID things, but also, despite what's on the news, financially, every healthcare person is taking a big hit too because all of our volumes have dropped down. So it's just a completely different environment and pretty difficult. Next slide, please. And for healthcare workers in particular, as of September, over 1,700 healthcare workers have died from COVID-19. And interesting, in my little hospital in Lodi, more than 74 healthcare workers were infected, and 2 of them died. So it was something we really had to think about. On the right-hand side is an amazing doctor, Dr. Lorna Breen, a 49-year-old emergency physician from New York, who contracted COVID while she was there, but also she felt like she was a weak link. She didn't know what to do. She didn't know how to handle this huge crisis, and she really felt incompetent for the first time in her life, and she ended up committing suicide. So it's a really big crisis, this emotional piece of it. And it's really one of the first times since Ebola that caring for our patients really put us at risk for harm to ourselves or to our families. And I know a lot of physicians and people that wouldn't come home to their families. They self-isolated for the short term, but now it's going on so long that now we have to come home, but how do we make sure we keep our families safe as well? So next slide. So now I want to talk in general, thinking about your teams, because this pertains to everybody. Sure, we feel vulnerable as frontline healthcare workers, but every single person is vulnerable to having these emotional problems. So thinking about who you need to support so much, think about people who could be at high risk for severe disease if they contracted COVID. Their anxiety is going to be higher than young people. Think about children and teens because they don't understand what's going on and the parents who have to care for them. Also think about your parents who are trying to work while they're trying to get their kids organized at school, because I know a lot of the nurses I work with have had to move to just working weekends so they can just be with their kids at home. And I can't even imagine trying to work a full-time job while you're trying to watch your kindergartner try and hook them onto remote learning. Also think about people caring for loved ones. Again, frontline workers from every single sector, all over everywhere. Again, that anxiety, because we've never dealt with anything like this. Anybody who has a pre-existing mental health issue or with known substance abuse problems. If you have team members who are socially isolated already and now they can't go out of their house, or people who are financially strained or insecure in housing. And you'll be very surprised that a lot of people you wouldn't think are going to be really strained right now. Next slide, please. So all of us in college or in high school probably learned about this as Maslow's hierarchy of needs. And it's really hard to get people to be really engaged in your work or thinking high-level thoughts if they haven't had their basic needs met. So their physiological needs first, then their safety needs. Then you can move on to do the higher-level things. So as all of us as leaders have to think, how can we support our teams with their physiological needs first, then move on to their safety needs, then we can move on to our higher-level work that we want to get done. Next slide, please. So for physiological needs, think about this. If you do have a team that has to work in person, think about providing food and provisions for them. The other thing, consider people who may have decreased income as well. My husband happens to volunteer at a school here in Sacramento, and he's amazed by the number of families that depend on that food to actually feed their families now, something we never had to think about it. Also consider transportation and parking needs if people have to come in person. See what you can do. Think about housing accommodation if isolation is required. If one of your employees ends up getting COVID, what are they going to do? How are they going to be isolated? How are they going to keep their families safe? And even more than, I think of all of these, if you have remote people working there, family resources are things that maybe you want to consider helping with. And it doesn't mean your company has to pay for it. Maybe you get a group together that they can share duties or different things like that. So childcare is really difficult now. Think about maybe doing shared homework and tutoring, or maybe on workshops on distance learning for parents, and also resources for the elderly. That's another really tough spot. Next slide, please. For other safety needs, for us, our PPE is everything. But when I hear about people not wearing masks, it's a hard one for me to swallow as somebody who's seen a lot of people with COVID. And I think people maybe minimize it and think it's going to be a cold. It's not going to be a cold. So emphasize to your team that they should be wearing masks at all times. Really have clear screening protocols if you do have them entering the workplace, or if you're delivering things or different things like that. Make sure that you do screening protocols. And make sure that the protocols are transparent for everyone. You want to have personal security at work. And another thing that you need to check in with your employees that you probably didn't have to think about as much before is if you look at domestic violence rates across the country, they're at very, very high levels now that everybody is sequestered at home for much more time. So think about how are you going to screen for that at your work as a leader, and what can you do? So next slide. So this is a time when leadership is even more important than it's ever been ever. So the first thing, and this kind of goes with what the panel was saying earlier, you really want to set the stage for the team goals and really create the supportive family atmosphere for all workers. So that goes for, again, for both in-person and remote workers, and really encourage people to think out of the box and come up with innovative ideas for how the team can support each other. So start with your mission. What's your mission for the work team? And recognize and really tell everyone that's at your work that stress and anxiety are normal. So for me and for a lot of people I work with, we see that some days are high, some days are low, and there's kind of this ebb and flow of things that we feel all the time, but emphasize that that's just normal. So be compassionate to everyone, really address their fears, and really talk about that there is real danger of coming in, and it can be hard to work from home, and what's our long-term plan. But also make small, manageable, SMART goals for the team. Don't be general. Set up very short, concrete things that you can accomplish in that week, and then move on to the next week. If possible, and this doesn't have to be a formal thing if you have a small company or anything, but ask someone if they want to volunteer to be a wellness officer to help you out, and maybe you call it something else. But someone who thinks about things to really make it better for your team that's working for you. Another thing is reduce non-essential tasks for workers. I love lean and that methodology of improvement, but think about really making things that are better for the work that you want to do, but easier for employees. And that's, again, having your employees thinking about this out-of-the-box kind of work that they can do. Next slide. So what can we do as leaders? Honestly, again, just like the panel said, you can't do enough communication. Communication all the time. Check in all the time. Make sure people are okay. Have daily debriefs with your team and make sure that everyone is doing okay. Consider having larger leadership town halls. And give your employees one-on-one opportunities to check in and just see how they're doing. And not so much about the work they're doing. Talk to them about their wellness. Talk to them about their home situation. Talk to them and see if they have other things that they need. And consider making small groups of wellness teams to work together that, again, not focused on work so much, but more focused on wellness and what can the teams do together to actually help each other get through this. Next slide. Really watch out for social isolation and depression. So if you're checking in with people and you see one person is sitting socially isolated, pull them in right away. Really try and get rid of the stigma of mental health. Especially in this time, there's nothing embarrassing about seeking mental health counseling if you need it. And it's actually, there's so many virtual things to offer now. Definitely look for that. Next slide. So really, here are some symptoms as leaders to watch out for. People may complain of physical symptoms that they hadn't seen before. So fatigue, being more tired than normal, feeling nausea, feeling faint, having dizziness, headaches, tremors, shortness of breath. I am seeing quite a few patients coming in with these kind of symptoms that end up being from anxiety. The next one is cognitive. If you have a high performer who's all of a sudden not doing well, think that they may need some help. If there's a marked deterioration in performance, if they're giving poor attention when they used to be pretty detail-oriented, if they're hypervigilant, or if they're blaming other people, or if you have to have way more conversations about when there's conflict between employees, think that they may be having some anxiety. On the emotional level, look for fear, if they feel guilt. Is there some grief with the loss of what they miss in their just daily life? Panic, anxiety, depression, anger, emotional outbursts. And then behavioral, look for withdrawal, if they're not involved at all, if they're antisocial, if they're complaining that they can't sleep, or if they have changes in their appetite, or if you have a suspicion that there's alcohol or drug use, have an open forum and allow people to come to you and actually talk to you about the things that they're feeling. Okay, next slide, please. So here's some things that are concrete that you could recommend for your employees. So start with the basics. So recommend to them that they get their regular sleep. You want them to pretend that, or not pretend, but you want them to have their regular day job that they have. But recommend to them that they schedule their life a little bit more. Avoid news or social media within an hour of bedtime. Avoid caffeine, alcohol, and really consider a sleep ritual using meditation or breathing exercises, or there's a lot of apps that you can get to help you sleep that you can recommend to your employees. Recommend that they eat well, encourage healthy eating, and consider providing it again at work, or consider having shared meals in your small groups, different things that you can do to help people do that. And then exercise. That's a huge thing to improving mental health and well-being. So with my two daughters, we're training for this half marathon that we get to do together, even though we don't live in the same town, but it's something that we look forward to, we talk about. And consider in the middle of the day short walking breaks, or if you are meeting in person occasionally, have your meetings outside so you can actually talk and get fresh air at the same time and maybe do. I knew a really amazing leader who used to do all of her coaching meetings with walking and talking, and it's a great way to get social distancing, exercise, and one-on-one meetings with people at the same time. Right, next slide. Another thing is some exercises you can recommend are progressive muscle relaxation. So where you actually tense certain muscles and then relax muscles through your body to de-stress the mind. Consider practicing this right at the start of meetings. It can be very helpful. Again, grounded meditation. Think about simple, short, and practical. If you bring up meditation to a lot of people, they're like, oh my God, you're going to ask people to sit around for a half hour and think things. But consider funding these apps for your employees. We did this even before COVID for our emergency employees. We funded Headspace, and they're just like 5-minute little things, and I've been actually shocked about how much better you feel after that 5 minutes of meditation. Also, self-compassion, and encourage employees to recognize emotions they're feeling and that they're totally normal. And actually putting a positive affirmation or quote on the mirror could help them, or just talk to them about things they could do to make themselves feel better for that day and feel like they're doing enough. Next slide, please. So I found a few resources for everyone. For breathing exercises, this is some free and available coaching for some people if you have some employees who are really anxious, or if you just want to recommend it to everyone. This is breathing exercises that deal with COVID, but you can it trains you to understand the risk, but also recognize the stress you feel is normal and can feel better. Another thing you could recommend is journaling, and encourage employees to set a timer for 15 to 20 minutes and really write down all the worries that they're having and then put them aside. So I often think in emergency medicine I have a bubble around myself because we're kind of prone to having people yell at us or do different things. But have your employees think about this kind of safe bubble that they're in, and they put aside their worries and stress over on the side and they've journaled about it. It's a really good method. Next slide. Really use the power of your team. Really nurture the network available. You're going to find that you have some people that will really flourish in this and will really take this leadership role that you wouldn't have thought they would have had before. Again, I love this idea of small groups that are doing mutual wellness checks on each other, maybe a group of 5 or 6 people that are checking in to make sure that everything is okay in their life. Encourage group sharing of exercise, meals, safe activities. There's something about seeing people in person that can be very helpful. So if they can do it safely, I think it's a good thing to do. It is interesting when you do these kind of meetings. I often say I used to have 4-hour staff meetings that have gone down to 1 hour because nobody likes to interact virtually. So there's something about being able to see people in person every now and then. Practice gratitude and recognize and reward positive behaviors. Consider making silly little contests and having people win them. And really having these concrete, well-defined plans are the best way to make it through this. Next slide, please. The other thing I want to recognize and talk to you about as a leader is really take care of yourself, because there's a lot of pressure being a leader right now. You feel like you've taken on a lot of emotional things that your employees are feeling. And remember that everything your employees are feeling pertains to you too. So be kind to yourself, move forward one step at a time, set small concrete things that you're going to finish for that day, and emulate the behaviors you want your employees to follow. Get headspace, do exercise, eat right, do all of those things yourself, and don't be afraid to ask for help. There are so many mental health kind of things. Pretty often insurance is covering these kind of virtual counseling sessions, and they can be very helpful. Next slide, please. I wanted to give this to the group. If you just search this, you'll be able to print this out pretty easily. But this is really a mass casualty kind of event. And there's been a lot of studies and a lot of work done for many years on this. And this is called a critical incident information sheet. And it's a real helpful tool to deal with the crisis. So if you want to share this with your teams, and again, to recognize that what they're feeling is totally normal. And have them watch for these signs for themselves, and then provide these kind of resources that they can use afterwards. Again, this idea that feeling the way they're feeling is normal and they don't have to hide it. We're here for you. We can help you. Okay, next slide, please. So any questions or comments from the group? Thank you so much for having me.
Absolutely, and thank you so much for this great presentation. I'm so happy to be hearing this afternoon because just doing the webinars across the country, honestly, there have been so many discussions on mental health, and I think it's just become, COVID has just been a catalyst for bringing it to the light, and, I think a lot of people are suffering right now in one degree or another. And I find this presentation super helpful, and I think that, I think the members will too, especially if you're dealing with people in your workplace or remotely or what have you, and you're seeing signs, but you're not sure if you should say something or how you should approach it, or even if they are the signs. So again, thank you so much for putting this together for us. I really appreciate it.
Of course. I think it's very unusual if people don't have any signs or symptoms right now. So if you're feeling fine, you're the outlier. So just recognize that it's totally normal, and there are resources to help.
Absolutely. So if anybody has a live question, you can hit *6 on your keypad now and ask that question live. And while we're waiting for that, I'll go over and see if we have any questions from the comment section. So again, if anybody has a live question that they would like to ask, you can hit *6 now on your keypad and ask that question. We'll just give them a couple of seconds and see if they're gonna. If anybody will ask a live question today. All right, Karen, I'm going to go ahead and read off some of the questions that we've gotten in. So the first question is from Patricia. What will the long-term effects of COVID, both on health and workplace changes, sorry, let me reread that, I messed up. What will the long-term effects of COVID, both on health and workplace changes, in your opinion?
In my opinion, there's two ways to look at this. I think it's going to change the way we work forever. But I do think it's an opportunity that we can actually try new technologies and do things in a different way, and maybe ways that are way better than what we had before COVID. So I do think there's this opportunity. Sometimes crisis breeds opportunity. As far as health goes, nobody knows. It's up in the air now. And I think what's the scariest thing about this illness is that you never know who's going to be affected severely or not. Sure, if you're an elderly person or something, there's a higher chance you're not going to do well. But younger people are affected, and we don't know what the long-term effect is on not only mental health, but on physical problems like stroke or, all kinds. We're seeing all kinds of long-term health problems down the line, but I think it's still up in the air.
Actually, if you don't mind, I kind of have a follow-up question to that, because you mentioned, between the generations. I'm curious, between the generations, say like Gen X and Gen Z, and then the now generation. I'm sorry, the now generation. I can't remember what they're not millennials, but they're can't remember. Maybe they are millennials. Are there, telltale signs between those generations? Does one show more signs than the other, or are there, anything that we can see the difference? Because I hate putting everybody in the same box. So I'm just wondering what the differences are.
Well, if you look at it, it's like almost like a line where it gets exponentially worse as you get older. So the young kids usually aren't affected much at all, and then the younger, and it's like a line that goes straight up. I think the scary thing though is that young people think they're invincible and it can't affect them. So most of them are right; they're going to be fine. But of those maybe 100 people, 2 of them could die. So it's like that. You don't know which one is going to be there. So when I see these younger people having parties or trying to have COVID-infected parties, it just drives me crazy. And then the other thing is then they're bringing it back to their family. So I think we really have to emphasize to the younger people to still stay safe, and there's no guarantee that you're going to be okay with this illness.
Absolutely. Thank you for answering that follow-up question and the original question. I have another question that's come in. Do you think this will push companies to become more involved in their employees' well-being, more mental health care, more involvement in self-care, et cetera?
I do. I think it's, again, this is one of the opportunities that come with crisis. This is a way that we can destigmatize mental health, because I think more and more people are going to be affected by this, honestly. And if we can say that this is just normal, and having mental health issues is just another illness. This is one of my passions, I actually wrote a book on emergency psychiatry, but my passion is that having these kind of problems, it's just like a brain illness, the same as if you have a flu or a cold or anything like this. And if we should think about it as just another physical illness, but it's affecting another organ of our body.
Thank you for that. Yeah, definitely. Great advice there. And we should all maybe pick up that book. I know that everybody has been affected in one way or another during this time, from one spectrum to the other spectrum. It's amazing. There's another question that's come in. How can organizations help essential workers who have children, elderly, or immune-compromised people at home?
Yeah, it's if you have essential workers, one of the things that I've seen that some of the places have done is actually provide like hotel rooms if they need to isolate themselves. They actually provide, I do like the idea of these small groups together to help them if they are trying to deal with school children at the same time. Again, the idea of providing the safety and the physiological things first, so make sure they have what they need, make sure they have a place that they can quarantine if they need to, make sure they have the PPE that they need all the time, make sure that you're letting them know what the latest data is showing, and again, all of those mental health kind of things too, making sure that they have access to meditation, make sure they have access to talking to coworkers or actually talking to mental health professionals. They're on the front lines, and there's a lot of stress on the front line right now, so you can't do enough, honestly. And if you think of anything unique or different that your company is doing, I'd love to hear it too.
Absolutely. I love hearing from companies from across the country, and I've been doing these webinars since April, I think, March or April, and I've heard about so many companies just really, stepping in and going above and beyond on the mental health, forefront, and some are just, it's amazing what people are doing across the nation and how they're helping each other. So, yes, please share with us what's going on in your company. If you can do that by hitting *6 now, or you can write it on the screen if wished. We have a comment here. I'm trying to kind of cipher it. It's from Kathy. It says, jumping to helping in, and it's Lodi. What are you most proud of, or how you've helped the team? Jumping to helping in. What are you most proud of, and how you help the team? Sorry, I totally messed that question up. I'm sure of it.
Yeah. Well, what I think now is we've really become more of a family than we ever were before. There's not much difference between whether you're a clerk or you're a housekeeper or you're a nurse or a doctor. We're all in this kind of together. And so that part's been really good. And the other thing is we've actually done we used to do a lot of performance improvement just around operations and different things. Now we're actually doing performance improvement around employee wellness, which we've never done before. So I feel pretty proud of that. And I do think we've provided a really good resource for the community. So I feel like people are really getting good care there. So I have to give a little plug for our little hospital.
Absolutely. That's great. Yeah, and thank you again. This topic is very close to my heart. Just hearing, you go over and do this presentation and all the, helpful information that's inside this presentation. And for anybody that's struggling at the moment, if you're not sure, I really encourage you to re-listen to this presentation in the membership area. This is all recorded. It'll be there, within 24 hours or less. And to reach out, if it's not through the membership area, you reach out through LinkedIn. We're all on there. So I really encourage everyone to have a listen to this again and just be, aware of what's going on around you and be kind. So I just want to say thank you again to our keynote for presenting this. It's been a great presentation.
Well, thank you so much, and good luck, everyone.
Okay, so we have now concluded our last keynote of the day. First, I want to say thank you to everybody that participated today, the keynotes and the panelists, the attendees, because without your continued support, these just wouldn't be possible. I also want to close off with something I've been doing lately. It's kind of an ongoing list that I keep track of from all these webinars and the ongoing, themes that happen during these webinars. They're very similar. So I'm going to share these with you now before we close off, but just keep in mind they're in no order of importance. They are all important. So I'll just start from the top. So take a break, walk away. Communication. It also includes listening to others. We are all human. Forgive yourself. Ask for help. Delegate. Reach out. Do not be afraid of change. Ask questions. And lastly, do something for you. So I'd like to thank Sacramento for your patience and time today. I'm sorry that we weren't in person as we normally are, but hopefully soon we'll all get back on the road and be in front of each other and share our ideas and thoughts, experiences, both professional and personal together. But until then, this is Shelley Fitzgerald signing off. Take care.